I was washing the dishes, don't tell anybody, one time and when there was a broken glass and I cut my hand. How do you know when you have a laceration of the hand on either the top or the palmar side, whether you've cut tendons or not, or it just goes down into the muscles or whatever?
Great question. Every time I see my wife doing that, I think, oh, it's Monday morning. 2 people are going to come in from the ER with a cut finger. Again, I think that you look at a lot of these things, and when we grew up, you just put a Band-Aid on it and went about your business. But if you can't bend that finger, if you're seeing pulsatile bleeding for sure, anything in the finger.
Pulsatile bleeding?
When you see that, when you see the spurts, yeah. If you see that in the finger, you almost have to have cut the nerve because the nerve lays on top of the artery. So if you hit that nerve, your finger's going to be numb. But I'm more worried about the fact that, hey, I got bleeding finger. I'm not really thinking about the sensation.
Could you lose your finger if you didn't do the right thing, maybe?
Yes, if you got it infected, if the wound wasn't closed, if you cut your tendon, there's a timeline there too. You asked that. If you're worried about that and you can't bend that knuckle, you've got about 6 to 7 days to fix that. If you don't get in there and fix that tendon within that time, it's almost irreparable.
So I've seen a couple of people that had that happen and they said, well, it'll just correct itself.
Nope.
Wrong.